If one wanted to test for the presence and concentration of a specific biomolecule, which we'll refer to as an antigen, one could perform a competitive immunoassay in which antigen is synthesized, which is radioactive. And so bacteria may be isolated, which can produce a version of this antigen, and if they are provided with radioactive building blocks, then the antigen is radioactive. If the radioactive antigen is then allowed to interact with an antibody, the amount of radioactive product bound the antibody can then be measured. In this first case, 100% of the antigen is radioactive because nothing else was added. But in a competitive assay, a source of antigen can be then added which is not radioactive. This could perhaps be a patient's blood. And so therefore, any unlabeled antigen would then compete for the binding sites on those antibodies with the radioactive labeled antigen. In this first case, there is not much of the unlabeled antigen, and so 90% of the antibody is binding the labeled radioactive form. But as the amount of unlabeled antigen increases, which is not radioactive, then less and less of the radioactive labeled antigen will bind the antibodies because the antibodies will also be binding the unlabeled form. Note that there will be steps in the procedure which will wash away the antigen which has not bound the antibody. This is important so that it does not confound results. There are a number of procedures which could perform this. Sometimes antibodies are bound to a substrate, and so this washing is a common step. And so not only are these testing for the presence of an antigen, but they can also test for the amount. The amount of radioactive label decreases as the concentration of the unlabeled antigen, whose concentration is unknown, as that concentration increases. This is a competitive immunoassay using a labeled antigen.